Good afternoon, Lago Vista. Mayor Ed Tidwell here, and I'm coming to you this afternoon because I have some important data that I would like to share with you. It has to do with COVID-19 and the social distancing that you hear about all the time, and flattening the curve, and all that stuff that we have been practicing on, and what has put us in a shelter-in-place order by the county. And I have some information, and it's some very important information. Um, so please pay attention. Um, you will want to hear the information that I have in this presentation. Um, after this presentation, I will be posting a link on my Facebook page so that anybody can access these documents. Because I'm only going through the first 6 pages. The rest of the documents, shows you the exact data and stuff that they use to create their model. And what I'm presenting to you today is a Texas COVID-19 pandemic toolkit. Was created by Lauren Ansel Myers with the University of Texas at Austin, and it was presented earlier today on local news. And the county has asked that all mayors throughout the 5-county region share this with our constituents to show you what they believe the importance of social distancing to be, so that we can flatten the curve. So I will go right into this. Hopefully it won't take me as long as some of my other presentations. But here we go. So, since 2012, a pandemic planning tool developed by the researchers at the University of Texas at Austin has helped public health officials plan for the consequences of a deadly and virulent virus. Now the pandemic modeler who developed the toolkit is studying COVID-19 and has built a new model to project the spread of COVID-19 across the United States. She has teamed up with Dell Medical School to assess the potential impact of the pandemic in the Austin Round Rock area. Note, Austin Round Rock area. So the numbers that I will be presenting in a while pertain only to the Austin Round Rock metropolitan area. Preliminary results from the local analysis were shared with Austin city officials and are being made public in a report today. In advance of scientific peer review due to the time-sensitive nature of this subject. The models clarify that without stringent social distancing, COVID-19 may overwhelm hospital capacities in the Austin Round Rock area by this summer. Initial simulations of the spread of COVID-19 in the area using UT's pandemic model showed that reducing daily contacts in the community by 50% or even 75% may not be sufficient to prevent an unmanageable surge in COVID-19 hospitalizations in the 5-county area, which is Travis, Williamson, Bastrop, Caldwell, and Hayes counties. However, the model suggests that reducing daily contacts between people by 90%, yes, I said 90%, flatten the curve enough to ensure that enough hospital beds, ventilators, and other resources could be available in the Austin Round Rock area during the next few months. The takeaway from this analysis is that the extent of social distancing measures, and our willingness to adhere to them will directly impact not only the fate of the outbreak, but also our capacity to provide life-saving health care for those in need, said Lauren Ansel Myers, professor of integrative biology and statistics and data sciences, who prepared the initial results. Myers applies mathematical models and computers at UT's Texas Advanced Computing Center to understand analyze, and predict the transmission of diseases and their effects. Her models use available data about how quickly a disease spreads, how many people a single case is likely to infect, demographics and transportation factors, and policy choices, such as school closures and other social distancing measures, on factors such as total deaths, infections, and healthcare resource availability. Myers and a team at TAC developed the original Texas Pandemic Flu Toolkit, a web-based service that simulates the spread of pandemic flu through the state to forecast the number of flu hospitalizations and help hospitals determine where and when to place ventilators to minimize fatalities. The tool also provides visualizations that help decision makers better understand the potential for spread of a disease, and models that can assist with rapid and fair distributions of antiviral drugs and vaccines when such medical countermeasures become available. The new COVID-19 models, like the Texas Pandemic Toolkit, are intended to both guide planning in advance of future pandemics and provide rapid analysis to support real-time decision-making during emergency situations. Myers' model shows that with current stringent distancing measures in place in many parts of the metropolitan area, the pandemic is less likely to crest this summer than would otherwise be the case. I'll repeat, the pandemic is less likely to crest. Let me repeat that whole sentence. Her model shows that with current stringent distancing measures in place in many parts of the metropolitan area, the pandemic is less likely to crest this summer than would otherwise be the case. Several uncertainties exist in this model, and the research relies on a series of assumptions about how quickly the virus spreads, how long people remain sick, how many people will be hospitalized, and how many cases exist in the community. These projections assume, based on the latest data from the COVID-19 outbreaks around the globe, that the number of new infections in a community doubles about every 4 days, and that almost 1 out of every 20 people who contract the virus will need hospitalization, Myers said. Myers' research is funded by the National Institute of Health, and she holds UT Austin's Denton A. Cooley Centennial Professorship. All right. So that's the lead into it, and I will get right down to the numbers. Excuse me real quick. Okay, COVID-19 projections for the 5-county Austin-Round Rock MSA with school closures and social distancing. Remember here, the quarantine that we're under, the shelter-in-place quarantine that we're all under, this closing of the schools, all of this is supposed to present the greatest amount of social distancing possible. So this is the COVID-19 projections for the 5-county Austin-Round Rock area. The team used the U.S. COVID-19 pandemic model to simulate COVID-19 epidemics in the Austin-Round Rock metropolitan area through mid-August 2020, assuming the following initial conditions and key parameters. It says here mid-August. I'll show you the charts and stuff here. Everything, this model here goes to August 17th, 2020. So from now to August 17th, 2020 is what these numbers are based on. So starting conditions, March 23rd, 2020, there were 84 infected adults and 18 infected children. And this is, again, remember, this is just Austin-Round Rock, 5-county metropolitan area. Currently, the epidemic doubling time is 4 days. So we go from 10 cases to 20 cases in 4 days. We go from 20 cases to 40 cases in 4 days, and so on. The reproduction number is 2.2. Right now, the rate, one person would infect 2.2 other people. That is the reproduction rate. One person infects 2.2. The average incubation period has been 7.1 days. The proportion of cases that were asymptomatic, 17.9%. All other model parameters, including age-specific hospitalization and fatality rates, are provided in Appendix A. Again, once I'm through with this, I will post a link to this outline, this PowerPoint presentation, and you can look at the Appendix A and all the other data that goes along with what I'm presenting to you here in this case. The full structure and the Texas component of the U.S. COVID-19 pandemic model are described in Appendix 2. Table 1 and figures 1 through 4 summarize results of COVID-19 simulations for the Austin Round Rock MSA. Each simulation began on March 23rd with 102 infectious COVID-19 cases. Again, that was 84 adults and 18 children, and ended on August 17th, 2020. The model structure and parameters are described in Appendix 1 and 2 below. All right, so I am going to go through Table 1, and you cannot see figures 1 through 4, but I will touch on them as they relate to Table 1. And again, I'll have the link posted on my page. Table 1, estimated cumulative COVID-19 cases, hospitalizations, ICU cases, and cases requiring mechanical ventilatory therapy and deaths for the Austin Round Rock MCA. This says MCA, the other says MSA. Anyway, for deaths for the Austin Round Rock metropolitan area from March 23rd through August 17th, 2020. The values are medians across 100 stochastic simulations based on the parameters given in Appendix 1. And again, you can look at Appendix 1 later. Okay, so outcomes. If there was no measures taken whatsoever, we just continued to go about our day as it was before any of this happened, there would be, the model shows by August 17th, there would be 1,765,147 cases just in the Austin Round Rock metropolitan area. Of those, 87,501 would require hospitalization. 14,659 would end up in ICU. 9,773 would require ventilators. And there would be a total of 10,908 deaths. Yes, if no measures were taken, this model predicts we would have almost 11,000 deaths from COVID-19 by August 17th. Now, I'm going to go over to these figures here a little bit. When you go to look at these pages, they have graphs. And there's 5 categories. I've just told you the first one, and that is no measures. But I want you to point out that estimated capacity, the bed capacity for Austin Round Rock metropolitan area is 4,000 beds. With no measures taken, we would exceed the 4,000 bed capacity in the Austin Round Rock area sometime between April 27th and May 25th. The graph shows it to be let's see. We would exceed beds somewhere around May 5th. Going down to the next line, the next figure, ICU capacity. There is a total of 750 beds. Again, exceeding that capacity sometime in early May. The total number of ventilators, also 750. So going forth, remember, just make note of this. There are total hospital beds available is 4,000. Total of ICU capacity beds, 750. And total ventilators available is 750. Excuse me. So now, let's talk about the social distancing measures that can be taken. I already told you what would happen if supposedly with no measures, according to this model. The next category is if we just closed our schools. Okay. They still show 1,758,960 cases. That's barely a reduction in cases of about 6,200 cases just by closing schools. So closing schools does not affect the total number of cases very much at all. They're still showing 86,069 hospitalizations, 14,419 people in ICU, 9,613 on ventilators, needing ventilators, and 10,542 deaths. So that's about 366 deaths that it would reduce by closing schools. So as you can tell, this disease is, again, not hitting the younger age population very hard. So the reduction in deaths was minimal, 366. Okay, so we go to the next step. School closures with 50% social distancing. It does not explain what measures are being taken exactly for the 50% social distancing. But there'll be, so third category is 50% social distancing. Fourth category is 75% social distancing. And the last category is 90%. So it's school closure plus 90% social distancing. And I can tell you that the goal for the Travis County county judge in this area is to try and achieve the 90% social distancing and thus the shelter in place orders. So let's go to category number 3, school closure plus 50% social distancing. It still shows 1,562,949 cases. Of that, 61,388 hospitalizations. Remember, with the hospitalizations, with the hospital beds being at 4,000, they're showing with the curve that sometime around mid-June, so we're going from early May to mid-June, we would still exceed the capacity of our hospital beds, our ICU beds, and ventilators. So cutting social distancing in half gets us about 6 weeks before we exceed our hospital capacity. ICU, 10,307. Ventilators, 6,871. And deaths, 6,317. So by closing schools and cutting social distancing in half, we would drop from roughly 11,000 deaths to 6,300. So about 42 to 4,500 deaths can be prevented or show to be prevented by this model with school closure and 50% social distancing. Fourth category, social closure with 75% social distancing. Cases, 689,107. Hospitalizations, 18,056. ICU, 3,040. People needing ventilators, 2,026, with deaths dropping to 1,472. Again, this is up till August 17th, 2020, which is roughly just under 5 months. So, how does that compare? Again, with no measures, we're at almost 11,000 deaths. With school closures and 75% social distancing, the model shows deaths drop to 1,500. However, with the number of hospitalizations, ICU, and ventilator needs, we would still exceed the capacity of the hospitals, the ICUs, and ventilators somewhere around the end of July, beginning of August. And that is with the 75% reduction. Now, I want to point out when you go and look at these things, they have the curves on them. Flattening the curve. When we talk about flattening the curves, and actually I'll actually hold this up so you can kind of see it. So you can see the curves here. Of course, the red is no measures, and then it goes to 50%, 75%, and 90%. You'll notice the peak comes earlier and stronger the less social distancing there is. We exceed our capacity faster, but it seems to peak and drop off much faster as well. And you can see by August 17th, the cases have dropped to about the same, but that does not, that's just the run of the disease and cases. This graph does not show the line of deaths. Here's your deaths. So you'd think that you kind of look at this one and you say, oh, well, the graph of not doing anything, rapid onset and then rapid decrease. That's pretty cool. This chart says here, May 25th. Is kind of somewhere around the peak, some May, June timeframe, and then it drops off drastically. But what it doesn't show you is the deaths, which is the bottom chart there. You can see the red is much higher than the 50, 75%, 90%. I'm sorry, because I'm holding this up to the camera. The writing is backwards, but you can get the idea of the graphs. But again, go to when I put this link out there, go to it and look at it for yourself. I'm just trying to make you aware of it. For the details, please go and look at it yourself. So we have one last category. And again, this is what Travis County is trying to achieve with the shelter in place. And that category is school closures and 90% social distancing. They believe that this measure could flatten the curve enough that we do not overwhelm our hospitals. I think the key in all of this is, or one of the most important things, is not overwhelming our medical capabilities. Not only is it in reducing the deaths and everything, but it's also how it affects our ability to manage the healthcare requirements. So school closure with 90% social distancing. Who knows when we all sit at home and watch Netflix. I think there's something about a tiger that's really popular right now. Anyway, that's what they are trying to achieve. So cases between now and August 17th would drop to 132,415 cases. 3,254 hospitalizations, 548 going to the ICU, and 365 needing ventilators. Now recall, hospital beds are 4,000, so hospitalizations 3,000. This is at the peak, or this is over the Keys, I'm sorry. But hospitalizations only at 3,200, so we'd remain under the 4,000 beds during this whole period. ICU 548, which is under the 750 beds, and 365 needed ventilators, which is also under the 750. So that is why they're trying to get to the 90% or 90% social distancing. And probably the biggest number and most important number that they're trying to achieve would be this 267 deaths. So, worst case scenario, we do nothing, carry on our lives as normal. We're looking at 11,000 deaths and overwhelming our hospitals by early May. Best case scenario, we close schools and we practice our social distancing. We get up to 90% less contact within the community, and we drop the cases to 267 deaths, and we do not overwhelm our medical capabilities. And that is it. That is all I have for you right now. Because I'm going to put the links out there, and you can go and check it out on your own. But remember, this model started with 102 cases and goes anywhere between now and August 17th, goes anywhere from 132,000 cases up to 1,765,000 plus. All right. So thank you very much, Lago Vista, and have a wonderful Thursday evening. Again, stay healthy, stay safe, wash your hands, practice your social distancing. Again, the experts and these people that have put this model together are saying that the number to achieve is 90% cutting our social contact by 90%. That is the magic number. Thank you, Lago Vista. Good night.